Okay, quickly, what do these celebrities have in common? Bella Hadid, Olivia Culpo, Lea Michele, Emily Ratajkowski, Isaac Gonzalez, Zoe Kravitz, Dove Cameron, Sophie Turner. Well, they're all celebrities that have or are rumored to have had a buccal fat removal. In today's video, we're going to be discussing the increasingly popular cosmetic procedure known as buccal fat removal. And while this procedure has been around for over 50 years, the number of buccal fat procedures has actually seen a significant increase in these past 2 years, with a reported 50% increase in that time period according to recent statistics from the American Society of Plastic Surgeons. It's become especially popular among those who want to achieve a more model-esque look. But is this really the right way to go about it? In this video, I'm going to explain why it's completely not. Because you see, buccal fat removal, also known as cheek reduction surgery, is a procedure that involves removing excess fat from the cheeks to create a slimmer and more defined facial contour. Many people seek out buccal fat removal in order to achieve a more defined and chiseled facial appearance, and that procedure can offer a number of benefits for those looking to enhance their facial contour. Because hollow cheeks are a sign of facial robusticity, they basically emulate the face of somebody who has more developed bone structure, which is obviously an attractive facial feature. But getting buccal fat removal as a cosmetic procedure is in itself ill-advised, and that's for a number of reasons. So in this video, we're going to cover the hollow cheek trend and why so many celebrities are getting the removal procedures but end up looking more gaunt and almost skeleton-like as they get older. So we see them everywhere, you know, this hollow cheek model-esque look, and it's invaded Hollywood with many celebrities getting the procedure done to achieve or to meet the status quo of what it means to have a sharp defined face. And mind you that having a sharp defined face is actually a very Western-centric beauty standard. In the East, having strong bone structure is still important, but their prominence, the features are less well defined because a softer, more rounded face is actually the preferred. But to best understand what buccal fat pads are, we need to actually go into the science of it. Buccal fat pads are a type of adipose tissue, which is essentially fat that's located in the cheek area of the face, and they're composed of cells called adipocytes, which store energy in the form of, well, you guessed it, fat. The biggest challenge to buccal fat pad removal surgery, and why a lot of surgeons have stopped doing it, is because this particular region is surrounded completely by very sensitive facial veins. But the interesting thing with buccal fat pads is that they don't seem to shrink or reduce with fat loss if you're already at a healthy or low body fat. What if you're already at a healthy weight and you still have chipmunk cheeks? For that, we need to talk about the Bichat ball. The Bichat ball and buccal fat pads are both collections of fatty tissues located in the cheeks and are often used quite interchangeably. However, there is a slight difference in the exact location and function of these structures. The Bichat ball are a smaller and more specific part of the buccal fat pads and are mainly involved in the contouring of the OG curve, which is a imaginary line. If you were to look at the face from the 3/4 angle, you'd see the hollowness of the cheeks. And although each face has its own specific characteristics and each person, well, has a unique face, the Bichat balls, also known as the Bichat fat pads, are often the cause of the chubby cheek look in individuals who have an otherwise normal weight or body fat level. They are present at birth and typically don't vary much throughout a person's life, regardless of weight loss or gain. They're composed mainly, again, of fat tissue, which is known to be more resistant to change in volume than other types of tissues. So it is quite hard to lose the chipmunk cheeks. And that's why we get the buccal fat surgery. A study by Dr. James Stuzan and colleagues dissected 12 fresh male cadavers and decided to study their buccal fat, and they found that even bodies with low overall body fat levels had buccal fat pads of the same size as bodies with a normal body fat level. And so that makes us understand that buccal fat pads and the Bichat balls don't really change much with someone's body fat, and that a chubby cheek look created by those fat pads can't really be fixed through weight loss. And so the ideal candidate for getting a buccal fat pad removal surgery is typically somebody with strong cheekbones that are poorly accentuated, or they're not very visible because of a fullness that's present within the cheeks, giving you that chipmunk look. And these patients lack tapering of their facial contours between the malar eminences, or the cheekbones, and the mandibular body, or the jawline. And the removal of the buccal fat produces a more angular appearance to the face. Reducing the fullness of the cheeks serves to highlight the cheekbones and makes the cheekbones appear more prominent. But in Dr. Stuzan's study, the team emphasizes that buccal fat removal is not suitable for malar augmentation, which is making the cheekbones look bigger and larger, and is not recommended in patients with malar hyperplasia, which is an underdevelopment of the cheekbones, or patients that lack fullness in their cheeks. Buccal fat removal will only accentuate a gaunt appearance in these patients, producing too much hollowing of the cheeks, and that's what we're seeing with these celebrities as they get older. The buccal fat removal procedure, or the reduction of the B-sharp balls, called a bichectomy, that is a tough word. You try saying that. Seems to be the perfect option for people with naturally chubby cheeks that still can't get a defined cheek look despite losing, body weight and all that fat. So the answer to this question is more complex, and there are nuances and considerations we need to take into account because every individual is different and has a different facial structure. What I'm saying in simple speak is that you will not all age in the same way. Some of you will have more hollower cheeks in the future than you do now, and others may never get hollow cheeks just by the process of aging. Many people are inspired by celebrities, and a trend has emerged where people who previously have chubby cheeks are undergoing the removal procedure to achieve that look. However, this trend raises a lot of concerns about the procedure itself, and there's a reason why a lot of surgeons are against it. One primary concern is that the natural loss of the buccal fat that appears with age is going to accentuate the gauntness if you do get the surgery early on. In fact, Martin Benjamin and colleagues in their paper, Buccal Fat Pad Excision, Proceed with Caution, showed that the buccal fat pads vary as we age. Its size drastically increases between the ages of 10 to 20, which is, the baby fat period, and then decreases over the following 30 years of life. So you will, for most of you, naturally lose it and get more of a gaunt face. You can just look at your parents to see how you might age. But another paper from Roerich and colleagues in their study, The Role of the Buccal Fat Pad in Facial Aesthetic Surgery, raised the concern of this new explosion in buccal fat pad removal procedures, basically saying that the long-term implications and the aesthetic results of the procedures are still not exactly understood. And how much of the buccal fat pad persists or diminishes as we age is still an area of debate because it is different for a lot of people. However, the possibility of causing premature aging and mid-facial distortion in the long run is a lot more clear. And so with all that information, I think we can come to a reasonable conclusion. Anyone unhappy with the definition of their cheeks or are looking to get a buccal fat pad removal procedure should take into account three important points. One is their own age, as the fat pads tend to shrink with age and are more present in the first 20 years of life. It seems smart in a young individual to wait and see how their cheeks evolve with age, to later discover that probably no procedure was realistically needed for that person to be satisfied with the look of their cheeks. Generally, this is around the 20 to 30 period, where as you enter your 30s, you do tend to look sharper, better, presuming that you take care of yourself in your 20s, because really, the 20s are now in the 30s. A second important point is to understand that the way someone's buccal fat pad and B-sharp balls vary with age depending on the individual. Although genetics plays a role and each individual's fat pads will evolve differently with age, raises the concern of the possibility of causing premature aging and mid-face distortion in the long run, as Roerich and colleagues have mentioned in their paper. In fact, volume loss associated with aging is actually quite a common aesthetic concern, and that's actually corrected with fillers and injectables later on in life. If you get really sharp cheeks in your 20s, you might end up filling it back in your 40s. Also consider that the face naturally starts to sag with age. Facial fat is disposed in different cavities and tends to reposition or shift within compartments from the gravity of just being alive. A study by Alan E. and colleagues explained that aging leads to changes in fat position, resulting in downward migration of the fat pad. With age, the malar fat pads, so your cheek fat pads, descends, and it shows a aging midface with a loss of homogeneity and a deepening of the nasolabial folds, which means essentially that your smile lines will naturally get deeper and your cheeks will naturally get hollower. Additionally, the gravitational theory of facial aging, mentioned by Alan E. in their paper, also explains that gravity plays an important role in aging and contributes to that sagging look. This suddenly makes the choice of having a fat pad removal procedure not that complicated, as not only the buccal fat pad changes in size with age, it also changes in position. Removing too much fat from the fat pads or removing fat at the wrong place might initially give you a great look, but it also has negative consequences on someone's future appearance, creating an overly hollowed look lacking in cheek volume, and this is what we're seeing with celebrities now. In fact, Martin Benjamin and colleagues in Buccal Fat Pad Excision, Proceed with Caution, show that the signs of characteristic aging such as the smile lines, the shifting of the cheek, and the reduction of total facial fat, are drastically increased by cheek hollowing between the ages of 30 and 40, meaning that if you get this now in your 20s, you will look much older than you really are when you reach your 30s and 40s. The last point to consider is your own facial structures. Some people think that they have full cheeks or undefined cheekbones and then they consider a fat pad removal surgery, but it's important to note that facial fat is not always the cause of an undefined face. The absence of prominent cheekbones or a strong bone structure could also be a contributing factor. Removing more buccal fat in these cases would only enhance the flattening of the cheeks, and as we mentioned earlier, Dr. Stuzen emphasizes that buccal fat removal is contraindicated in patients that already lack fullness in their cheeks. For those patients, adding volume using dermal fillers might actually be a better option in order to achieve a more defined look and better facial contouring. We touched on this process in this video here, explaining the difference between more prominent cheeks or a more hollow appearance. This is called pseudozygomatic projection, where you can make the peaks of the mountains larger or you can make the valleys deeper to get the same end result. And so despite many celebrities getting buccal fat removal procedures done, you should consider your own individual features and characteristics. It's going to be interesting to see how these celebrity faces do evolve with time, and I think we're starting to see some of the early remnants of it. For those interested in the procedure, and we do advise against it, but there will always be some people who do want it, then there are a couple of things to consider. Firstly, you're going to have a professional that understands facial symmetry and has a conservative approach. In fact, in James Stuzen's paper, The Anatomy and Clinical Applications of the Buccal Fat Pad, advocate a conservative excision of the buccal fat pad. Only a small amount of fat should be removed initially to prevent over-resection. Often, it's necessary to remove only 1 to 2 grams of fat to obtain the aesthetic result desired and adjust your expectations accordingly. In very full-cheeked individuals, it may prove necessary to remove up to 4 to 5 grams of fat on each side. The result of resection or cutting are apparent at the time of the operation. Harvesting should be done incrementally, and the change in the facial contour should be appreciated rather than just removing what comes easily as the flavor of the month. An aggressive initial resection will lead to a later hollowed out look, which is actually quite difficult to correct. They also indicate that providing cheek contour is pretty symmetrical before your surgery, a near amount of equal fat should be removed from both sides. If asymmetry exists prior to surgery, this can usually be harvested slightly more fat from the fuller side. That's pretty straightforward. The procedure involves making an incision inside the cheek and then removing some of the fatty tissue from the buccal fat pad, which are located in the cheeks. So it's worth noting that these studies report average in this recovery time will probably change from person to person. And it's also important to keep in mind that the full healing after the surgery can take up to 3 to 6 months, and that the final outcome of the procedure can be assessed more or less during this time. So when it comes to the safety, Lucas Boren-Mura and his colleagues looked at 71 patients in their paper, and 6 of them presented complications, which is around 8%, such as trismus, facial asymmetry, and hemorrhages. So there you have it, Buccal Fat Pads 101. If you're interested in knowing more about your own facial features, because at Kuz we specialize in helping people look their best, or you're curious to see how certain cosmetic or non-cosmetic changes would look on your face, you can access a free facial report over on our website and order one for yourself.